very relevant question. Okay, at first, let me tell you, some of these answers are still being sought. They are not, all the answers are not there. And it's a very genuine, relevant question. And we've done like 100 seminars on that already in last 2 months. What does the data tell us? What is absolutely clear is that if people with diabetes, hypertension, and heart disease get infected by the virus, their outcomes are poorer than the others. What does that mean? So if, let's say, I mean, now this is a bit morbid because it's a public forum, but nevertheless, supposing the risk of dying from COVID is 2%, 3%. If you have diabetes, it becomes maybe 6%. So 94% are not dying. Okay, so you have to understand relative risk and absolute. This is just an increase in risk as compared to those who don't have diabetes. If you add hypertension and heart disease to that, your risk of succumbing to COVID goes up another few percent. So anywhere between 3 to 5-fold of the total. So which really means that you're not. Most people with diabetes and COVID sail through comfortably. Maybe with some assistance, obviously, of good doctors, but otherwise, yes. But yes, it is true that people with diabetes, hypertension, and heart disease are more at risk for poor outcomes as compared to someone who doesn't have these. Now, clarifications. This is the clear part, no confusion in this. Where there's confusion is, are all people with diabetes at greater risk? It's not clear. It's not clear that people with diabetes will catch the infection very quickly. Probably well-controlled diabetes, people who are otherwise healthy and well-controlled and not having multiple other, like a full range of prescription medication, they are not very likely to be at greater risk. Perhaps the older diabetics with multiple conditions are the ones who are at greater risk of getting the infection. So you distinguish between getting the infection and outcomes after you get them. Outcomes after you get them are worse in diabetics, but getting the infection, probably. Even if you have diabetes and if you get the infection, if your diabetes is managed well, overall management is good. You start out with the COVID with an HbA1c of 6.5, or you start out with COVID with HbA1c of 11. If you start off with that poor control initially, and then get the virus, obviously your outcomes will be worse. So in one line for everybody, if you keep your diabetes well controlled, blood pressure under check, take your medicines regularly and follow the basics, which we've talked about many times, your risk of diabetes, of getting the COVID is almost probably the same as the other population, and the risk of poor outcomes comes down drastically. So you can't put all diabetes in one bucket and say, yes, sir, diabetes. Somebody has just got a mild high blood glucose, well controlled on single drug or no drug, and somebody is on multiple medications and so many things. They're very different risk profiles. Depends on what the symptom is or what the problem is. If it is just a routine visit, and you're feeling absolutely fine, it's your routine 3-monthly or 6-monthly visit or something to the doctor, yes, you should postpone it. But you should get your test done. You have fairly safe laboratories which send technicians at home. You can go out to the gate of your home or whatever and get a sample drawn there. It's not that risky. Okay. There is always a risk in everything, but you're minimizing your risks. Okay. Do not delay your tests. You can avoid some tests, but do not delay your regular tests too much, maybe a few weeks if you're waiting for that. But this is not going to go away in a hurry, this virus. So you can't delay it indefinitely. And like since the morning, I've been struggling with people who stopped testing after all this happened. And now their sugars are 300 fasting, 500 pp. All you have to do is make sure you test your blood glucose regularly and maintain a chart. When you're confident and comfortable of getting the lab guy home to take your sample, please do that. And if it's time for your test, get your test done. Take a video consult with your doctor or an online consult. Most senior doctors are now providing video consult and online consult facilities. People with thyroid or diabetes can make use of them very well, because often if it's just a routine checkup, you have to share your numbers, right? And I think that's a very good platform. Increasingly, this will happen. So I think you should, if you're feeling completely fine, avoid a visit to the eye doctor or dentist now. If still, do your blood glucose test, get blood pressure tested. If you don't, you should get access to a BP machine, maintain a record, get a video consult with your doctor. If he feels things are looking great, you don't even need the other blood test right now, go on. If he feels no, it's time to do the other test, go get them done. So that's how I would do it.